think we've covered a lot of ground today around, the impact is probably bigger than we're imagining. It's probably more long lasting than we're imagining. You have to meet employees where they are. One size doesn't fit all. So I think those are all kind of big macro themes. But, practically speaking, as a provider of mental health services, I actually think one of the biggest barriers in the workplace is that we weren't from a funding or a budget perspective, we weren't built to tackle mental health as a business issue. So we sometimes talk to the well-being teams, we sometimes talk to the health and safety teams, we sometimes talk to the disability teams, we sometimes talk to the benefits teams, and that's a bit of, I think, that's something you control as an employer, right? So I think just really looking holistically at your strategy, and I'd like to see mental health evolve along the way of things like diversity, engagement, to really be a true business issue. Right now, it's still sort of chunked up across, many departments, and I get it. If you're a school board and you have school bus drivers, certainly their mental health and well-being actually does become a safety issue. So I'm not saying it's an easy solution, but I think that is one of the barriers as we look at evolving our workplaces and how, as leaders, we think about mental health. I think there's an opportunity to take a more holistic, codified view.
But also that the business case around mental health is actually a pretty simple one. If you start looking at the cost of one day off work, one absence, one disability case, one accommodation and saturation in your workforce, one LTD claim. So if you want to start there as just an easier way of usually capturing some data and gathering data to help build that case as a starting point, to invest or to actually say what segments of my population are being impacted, that's what I would leave the group with.
Well, Kristen and Nigel were pretty thorough there, but I'll just sort of add an element that maybe we didn't talk a lot about today, which is you have to have the mechanisms that we've discussed today. But Kristen mentioned that leaders have a lot on their plate and they're out there kind of managing the business. But what I've seen is the openness and the desire for operational leaders to be better in this space, at recognizing, at talking to their employees, at getting it out in the open, the topic out in the open, and then also the understanding that the associates can come and talk to that frontline leader about anything. And then you've got this backup of programs that they can help that employee. They're not going to be experts. Kristen made the point. We can't make them experts, but we can make them ambassadors for the programs in which we've put in place. So I think taking them along the journey and appropriately investing in their training, both what I've seen is they love it. They love to have that tool set, and the minute that they use it one time, it's unbelievable the response that we get on the thank yous for helping me help my employee in that moment. Often we talk crisis, I know that, but it could be a moment of anxiety or a moment of a struggle at home with a sibling, with a child, with a parent. So that holistic side we talked about is both the programs when it gets to that point, people need help outside the organization, but layer it in with taking your people leaders along the journey and then communicating that with all your employees.